Births in the Unified Health System in 2 Brazilian states, a qualitative analysis in 3 moments of the last 20 years. We want to understand how was the care of deliveries performed by the Unified Health System in Brazil in 3 moments of the last 20 years, and to verify that births are being performed at the rate recommended by the World Health Organization, as the optimal cesarean section rate between 10 and 15% of all births. The data used are official and made available by the federal government of Brazil, so quantitative data are analyzed qualitatively, since what matters to us is to consider the quality of the information. The database offered is quite detailed and has evolved over 20 years, but is still insufficient for most researchers to use, so we decided to bring the relevant data to a more current database, thus allowing a broader analysis of the available data. The analyzed periods are divided into period 1 to November 1998, period 2 to November 2008, and period 3 to November 2018. So in this summary, we present the table 1 with the data from period 3, where we see that the ratio between the number of cesarean deliveries for normal deliveries is 58.45%. Comparatively, in period 1, in Mato Grosso, the ratio was 36.81%, and in period 2, the ratio was 20.36%, indicating that the ratio was moving towards the ideal, but was not sustaining in period 3, as will be commented at the conclusion. In Table 2, the period of November 2018 in the state of São Paulo, the ratio between the number of cesarean deliveries for normal deliveries is 20.80%, this value among the lowest in all periods of the 2 states. For the general research question, where we question if the WHO recommendation regarding whether the proportion between cesarean deliveries is up to a maximum of 15% of normal deliveries, we found that the goal was not achieved, even if progress has been made. Punctually, on November 2018, São Paulo, with 20.80%, is close to the indication of WHO, but Mato Grosso returned to grow in this relationship, being, in this last evaluation period, more than 3 times above the recommended index. In summary, it can be seen that are incentive campaigns for normal birth, but the desired result has not yet been achieved, even with the efforts of global entities and the government at their different levels.